And I don't really know what comes next. I'm just doing my best, even though I'm so stressed out. Everything just feels like a test that I fail, so depressed when I can't seem to get.
Hemant Kumar sir.
This call is now being recorded.
So shall we start, sir?
Yes, madam. Yes.
Okay, sir. Thank you, sir. So you can start, sir.
Hello.
Yes, sir. Ready.
Okay. Good evening, respected all the teaching faculty members, my dear Shalatantra teachers, students, PG and PhD scholars, and all other Ayurveda fraternity friends. Today, every Friday, National Susita Association organizing national webinars regularly with the support of Paroli University. And today I wholeheartedly welcome Dr. Priyanka in this platform, going to deliver a guest lecture on cupping therapy and its clinical application. And I think Ayurvedic people's well known about Rakta Mokshana. And this is also one of the type of Rakta Mokshana. Definitely this talk is very useful for our Ayurveda fraternity and especially practicing of Shalatantra practice. And I welcome Dr. Priyanka for this lecture. All the best.
Thank you so much, sir.
Dr. Priyanka,
Yes,
I will share the screen.
Sure, ma'am.
You
Sure,
can
ma'am.
start your lecture.
Yes, ma'am. May I start, ma'am?
You can start, doctor.
Okay, ma'am. Kindly give the first slide. Just the first slide, the welcome slide. Yes, no, previous one, first one. Yes. Okay. Good evening, everybody. Today I'm going to present my topic. But before starting my presentation, I want to give a special thanks to Parul University and as well as National Truth Association, because both of them have given me a very good opportunity to perform in this platform, and I'm very much grateful for them. So now, I'm just first, before starting my topic, I'm just going to show you one video clip. Madam, next slide. Yes, this video, I think this is actually a very famous movie. I think so many people already seen it. The name of this movie is Karate Kid. So in this movie already it's showing that one small kid, he was treated by his trainer with the help of cupping therapy, which already becoming very much popular nowadays in whole worldwide. So based on that, I'm just today going to present my topic, and my topic name is the cupping therapy and its clinical. Yes, madam, next slide. Next slide. Cupping therapy and its clinical applications. I'm Dr. Priyanka Ganguly, Assistant professor of Shalyatantra department in BSRGMSCH, West Bengal under the Techno group, as well as the PhD scholar in Parul University. Next slide. Yes. Now the question is, what is cupping therapy? Usually it is the combinations. Ma'am, next slide. Next slide. Yes, cupping therapy is the procedures where the several types of cups, okay, that those are using, usually those are applying over the skin layers to just get rid of different kind of disorder like pain, inflammations. Ma'am, next slide. Yes, yes. You see the one lady, she is also showing how it should be performed. Usually the different, several types of cups usually applied over the skin layers, and usually the suction mechanism we are using just to make those areas vacuum, and afterwards automatic the blood circulation is getting improved over that areas, and it is also helpful to get rid of any kind of pain, inflammations, or sometimes not only this, physical problems getting overcome, even some psychological problems like depressions, anxiety, even in case of the insomnia also it has been seen, it is also working very nicely. Next slide, ma'am. So now coming to the history of the cupping therapy. So next slide. Yes, it has been seen at the 1550 BC at the first time in Egypt. The entire cupping therapy has been recorded yet in papyrus, and it already, this evidence we got afterwards, and the first time it was practicing over there. Afterwards it's spreading all over the China as well as all over the Middle East also, even Iran, Turkey and those Middle East areas also. This cupping therapy is also becoming very much popular, but by some other name like hijima, some cupping therapies are also there. Not only that, even China also, their main concept was entirely different, because they are believing over the chi. Chi is the actually vital energy. So based on that, they are also applying over the body, because they are having some another concept, that is yin and yang. Yin is actually the negative energy and yang is the positive energy. So the main factor is to making it equilibrium conditions, and based on that they are using actually this cupping therapy. It is actually helping to make it equilibrium conditions, and then and there the vital energy or the chi becoming energized. So based on that they were using this cupping system. Even in India also 600 BC, we are knowing our Acharya Shusruta. He also first time he also started to practice this kind of cupping system, but in some other name, because in our science there is having Sringa Avacharana, there is having Alabu, there is having Ghati Yantra. So all those three systems also having the same mechanism, that is nothing like that suction mechanisms. Same suction mechanism also we are using in case of Sringavacharan, Ghati and Alabu, and he very nicely explained this entire therapies in our Shustra Sangita Sutra Sthana 13th chapter. Next slide, ma'am. So now I'm coming to the next slide, that is the originations of the concept of cupping therapy. Actually, this therapy came from our root. That is the, what is the root? That is the Rakta Mokshan. These procedures, from there only the cupping therapy originated, because we are knowing Rakta Mokshan. Rakta Mokshan, usually it is the combination of the two words. Rakta means blood and Mokshan means usually just to let out or removing out the blood. Okay, so Rakta Mokshan, why it is required? Because usually we are knowing in our science it has been told that three doshas are there: Vayu, Pitta, and Kapha. But Acharya Shusruta, he also mentioned that Rakta also one of the Chaturtha dosa, because whenever Rakta also becoming vitiated, then several disorder also getting originated in our body. They are having several disorder. Even so many examples also are there, like the Rakta Pitta, Vata Rakta, and several. So what happened if those impurified blood is not getting removing out? Then definitely the disease or this disorder will be in the aggressive mode. So that's why he also mentioned that this kind of vitiated blood should be removing out or to let out. So that's why this Rakta Mokshan, or the better to say the totally blood letting therapy is originated. Next slide, ma'am. So whatever I have told, yes, same like. So from on that purpose, actually it has been seen it whenever this vitiated blood is getting just let out from the body, then usually the body becoming purified. That's why Rakta Mokshan, this therapy usually under the Shodhana therapy, according to Shusruta, according to Bhagavata, those all acharyas mentioned it as the Shodhan therapy, because Rakta Mokshan is usually purifying our blood, just cleansing our blood and making us properly well-being. Next point, next slide, ma'am. So now we already knowing the type of Rakta Mokshana. Slide change, ma'am. So they are having several Rakta Mokshana types, that is the Sringa, Jaloka, Shiraveda, Alabu, Ghati, and Prachana Karma. So what happened? Usually by the two categories, that is the Shastra and Ashastra. That's also we are knowing that the two categories are there. So we had made it this entire classifications. So Shastra means usually whenever we are applying this kind of Rakta Mokshana with the help of any sharp instruments. Okay, like in case of the Prachana Karma, in case of the Shiraveda, usually we are using the surgical instruments, right? In case of the Ashastra, this is entirely natural procedures where we are using the Jaloka, we are using the Sringa or the horn of the animals, Alabu, that is the pitcher gourd, and the Ghati Yantra. Okay, so in that cases, Shastra is not at all required. Now coming to the next one, that is the mechanism of the cupping therapy. What is the actual mechanism? Why should we go for that? Just change the slide. Yes, in our science there one sloka is there. It has been told yet that in case of the Sringo, Alabu, and Ghati Yantra, whenever we are using, especially for the Sringa, Tatra Prachita means first we have to do the Prachana Karma. We have to just make this incision. We have to give this incision over the skin, and afterwards this horn should be placed over that area, but the hollow, the narrow orifice, that should be that one should be sucked by the physician. When after covering that area along with the tanubasti, that means very thin cotton pad, okay, and afterwards achushanat means the person, the physician should suck, like that it has been told it. Even in case of Alabu and in case of Ghati Yantra, here also showing Sha Anto Deep Alabang. The sloka was there. Sha Anto means inside the Alabu. Usually we are just rotating one or we are keeping inside there one burning any light or any burning deep light. Okay, so we are keeping there, or candle. Okay, we are keeping there. What happened then and that this area becoming empty because the air is expanding. Okay, so this hollowness, this emptiness is occurring, and then and that we are just turning the down this cup, and cup or Ghati Yantra, whatever, or the Alabu, and we are putting over the skin area. Same things, if we are going to see here, the same things also in the modern cupping therapy also, they are applying here also. So what is the modifications of the Sringo, Alabu and Ghati Yantra? Next slide. Here I'm going to show you that nowadays the entire this classical Sringo, that's also has been replaced by the optic fiber tube. They are also using nowadays, that is the optic fiber tube. Next one. And even based on this suction mechanisms, different machines also they have introduced, that is the breast pump and the suction apparatus they have introduced, which also simultaneously using in case of Sringa also, because Sringa also, it is also joining along with another pump machines. Okay, so it is, we are pumping, and then under it is also helping to suck the entire blood which is stagnated over the areas. So nowadays it is also very much common plastics, not common plastics, even the fibers also using for modifications of the Sringa or modifications of the Ghati Yantra also. Next slide. So this is the procedures. It actually nowadays silicone also, it is also using to made up this kind of cupping because it is very much helpful to moving. You see the next picture, they are also showing that it is very useful to moving from one place to another place. That's why it is also helping to do the massage therapy. So this kind of cupping system not only relieving the purified blood, even as well as it is also giving the massage to the deep tissues also. Okay, next slide. So types of cupping therapy. It has been seen here there is having actually the two types of cupping. First one is the dry cupping, second one is the wet cupping. In case of the dry cupping, actually what happened, this kind of cupping, it may correlate with our science, that is the Ashastra Pita Raktamokshan. Because here, Prachana Karma is not at all doing. Only the part where we want to do the there at first, after making this area vacuum, and this cupping set we are making vacuumed, and afterwards another we are putting over that exact area, and afterwards by the suction or by the pump machines we are just elevating the skin where we want to increase the actual blood circulations. Okay, and afterwards we are keeping it for just from 3 minutes to max 7 to 8 minutes. Okay, afterwards we are just removing out that portions. There is no record of any letting of the blood, only just we are trying to increase their blood circulations. Okay, but in case of the wet cupping, usually at first we are giving some incision over that area. Okay, and afterwards we are just doing the same like the dry cupping. So what happened, whenever we are keeping this cupping set over that area, then automatically due to the occupying the empty places inside the cupping set, automatically the blood is starting to oozing out from that area. Okay, so what happened, any persons who is having the low back pain or sometimes the cervical spondylosis or neck pain, anything like that, even the tennis elbow also, for them also it's very helpful, because sometimes due to the stagnations of the blood or due to the lack of the blood circulations, they are also feeling the pain. So it is also giving the automatic relief of the pain too. Next slide, ma'am. So they are also having different types based on some other categories. Okay, like the technical types, that is depending upon this dry cupping, flush cupping, wet cupping, massage cupping and all. And another types is that is the power of the suction related, that is either it will be high, otherwise it will be medium, or the low or light. Okay, or the pulsatile. Okay, pulse like sound would be there, and slowly usually that knot would be like continuous. The pulse would be there. Another types is that method of the suction related types. Okay, so based on this, another different types also mentioned, but mainly we are practicing in modern era also the dry cupping and wet cupping grossly. But nowadays this laser cupping also becoming very much popular. Okay, and based on the cupping sets also, they are also having different types, like plastic cupping sets are there, glass cupping sets, even rubber cupping is also there. So but it has been seen yet nowadays rubber cupping also becoming very much popular. It is easy to handle, easy to use. Okay, and based on cupping sets related to the method of suctions also, they are also having different types. Okay, now different kind of cupping set already using nowadays. So usually previous we were using the horn. Afterwards, bamboo made cupping sets also becoming popular, but nowadays glass cupping, and along with the fiber, along with then nowadays this rubber cupping also becoming popular, and very latest the silicone cupping also came yet. Now the matter is, what is the mode of the action of this cupping therapy? Why should we apply? Because it has been seen yet that whenever this cupping therapy is doing over some areas, what happens usually, why the people are feeling the pain, why they are feeling the inflammations and all. It has been seen yet on that area usually the stagnation is the main point. Sometimes blood circulation getting obstructed. So usually not only the blood circulation is getting increased, as well as lymphatic channels, their circulations also becoming proper. So it has been seen yet that if the persons whose blood circulations along with the immune this lymphatic systems both are having in the proper circulations is going on, for them the immunity system also becoming boost up properly. So that's why cupping system not only helping to blood circulations, even as well as it's also helping to get rid of any degenerative disorder, along with the any kind of immunity system also getting boosted up. Here also I'm showing that whenever this this cupping system usually performing, then and there the extremities, even all over the trunk, even head to toe, in all portions usually the circulations becoming increased, and if any stagnation is there, it is also becoming reduced. So cupping therapy points, there are also different cupping therapy points has been mentioned yet for the trunk portions, especially for the muscular regions. Already some points already mentioned in these classes. It's not possible to describe entirely, so just I put all those pictures, and they are also having different points over the face, head, neck and extremities. Next slide, ma'am. Yes, so those are the points. There's also we are usually putting the cupping set based on, sometimes when we are going for the head portion, sometimes some people are having headache, or some people are having some hair growth problems and all, so it's also very good for them, even for varicosity, even for the any kind of Raynaud's disorders. Therefore that also we are going for the extremities and all. So now going to the benefit. Actually it has been seen it as the benefit of the cupping therapy. That's whenever we are performing the cupping procedure over the patient, their trunk portion, chest portions or any other portions, usually it is stimulating not only the blood circulation, even it's stimulating the entire organs which is situating over that area. So it is also affecting over the kidney, it can affecting the lungs, our stomachs, intestine, spleen, everything can be stimulated by the cupping therapy. It is actually related which portions we are going to apply. So it has been seen here in case of the relieving of the any kind of pain, that may be sciatic problems, sciatic also it is working very nicely. Even in case of the lumbar, low back pain, or cervical spondylosis, or any kind of neck pain, even tennis elbow, even sometimes it has been seen yet in case of carpal tunnel syndrome, and any kind of muscular pain, it's working very nicely. And usually in case of the osteoarthritis, not only osteoarthritis, in case of the rheumatoid conditions, that's also working very nicely. So this procedure is also very easy to handle. Next one. In case of the lungs, there's also is having very good effect, because usually it has been seen that not only blood circulation, even along with some other bronchodilatations also usually occurring due to this kind of cupping therapy. That's why in case of the asthma, in case of the flu, even the persons who is having the tendency of the cold allergy event, for them also, if they are performing this kind of cupping therapy, by some sittings they are getting becoming improved. In case of the cardiac problem, actually 1930s, before that, in case of the congestive heart failure, their cupping therapy was the very popular procedures which was performing that time. But nowadays some other procedures came yet, but still now in China and some other Middle East area, they also are applying this kind of cupping therapy. Even not only that, even whenever the person is having the hypertension, in case of the hypertension also, when the blood also becoming much more giving some pressure over the arterial wall, and like that time also cupping therapy reducing this kind of pressure as well. In case of the headache and migraine also, it has been seen it is also working very nicely, because it has been told here that due to some stagnations like that, by the qi, by the yin and yang properties, but just by the concept of Chinese acupuncture and all, they are also telling it is also helping to reducing, just eliminating all those properties. And now coming to the chronic fatigue syndrome, because what happened whenever the person is becoming fatigued, there it has been seen that entire blood circulation is also getting hampered. So if they are taking this cupping therapy in regular wise, okay, so it is also helping their or boosting their blood circulation, as well as they are becoming energized, their kinetic energy also stimulated. In case of the psychological disorder, most of the cases, that is the mood swing problem, is having a mood swing problem or depressions, anxiety, stress. In that cases, if the person's also having the in some regular, not regular wise, and periodic wise, if they are taking this setting of the cupping therapy, that's also automatic helping their psychological improvement and all. Okay, next one. Okay, and in case of any kind of skin diseases, mostly the acne or the pimples, along with the abscess or the boils, even eczema, psoriasis, this kind of cases, even urticaria, that's also helping, because what happened, it has been seen here that the blood circulation, as well as whatever the there any kind of impurified blood, which is actually main cause or main they are leading this kind of diseases. So by this therapy, weight cupping therapy, all those impurified blood is usually removing out. So automatic, just like our Jalokava Charana, that's also we are doing, just removing out. So same like the cupping therapy, also doing the same like. Here, hair growth, what happened whenever it is applying over the head portions, hair portions, what happened, it is also giving the proper blood circulation over the root of the hairs. So we is having the tendency of the baldness and all, or the hair falling problems, if they are also taking this kind of procedures as some periods and all, then they will be benefited. Okay, next one. That is, in case of the insomnia also it has been seen, because most of the cases it has been seen in the insomniac patient, they are having the tendency that sometimes they are having some blood pressure problem, high blood pressure, or entirely the anxiety patients, all time tension is there. In that cases also, whenever the tensions also getting reduced, their automatic their sleeping pattern also becoming changed, and it is becoming healthy. Previously, it has been seen yet that in case of the infections, the mumps, in case of the cholera, in case of the yellow fever, it has been seen in the 18th century, the cupping therapy was practicing vigorously, okay, especially the wet cupping. In case of the gastrointestinal disorder, there also it has been seen yet that stomach, intestine, and the entire our digestion problems, everything is getting rid of, because all those organs are getting stimulated by this kind of cupping therapy. That's why in case of the constipated person, when the stagnation is the main problem, there's also after doing this kind of cupping therapy, it has been seen yet that their constipation problem, even some irritable bowel syndrome problems, that is also they are get rid of only for this kind of cupping therapies and all. Even in case of the anemia, they are also having little bit we have to be little bit cautious, because if the person is having much more low HB percentage, for them usually we are not recommending cupping therapy, because sometimes profuse bleeding, there is no chance of like that, but sometimes it's happening. That's also may lead some other complications, so we are avoiding. But another fact is it's also showing some good effect for some persons also, but this is contradictory topic. That's why in sometimes anemic patients is working, sometimes it is not applicable. But in case of the urinary disorder, it has been seen as same like the stomach, intestine, spleen and all. This is also stimulating our kidney system. So whoever having the dysuria, who is having the polyuretic problems and all, in that cases also, if the cupping therapy is performing weekly once or twice, is also helping for them. Not only that, the persons, especially for the females who is having the gynecological disorder like dysmenorrhea, sometimes they are having some menstrual cramp is there, okay. So in that cases also, if weekly twice they are taking this kind of therapies, that's also showing a very good result for them. Okay, next one, coming to the methodology. Okay, what kind of method usually we are performing? So during my PG, when I was in Alva College, so during that time we all together perform one Sringavacharana. Okay, so first after just cleaning this entire area where we are going to apply this Sringa with the help of the surgical spirit, and afterwards we just put this Sringa over that area just to just demarcations the area. Okay, and this is the actually suction palm, just we are giving this palm to just marking this area. Okay, this is the Purva Karma, and afterwards we are just removing this one, this horn. So this area already marked by this suction therapy, because what happened whenever we are giving this suction, we are giving this pressure over that area, then and there the skin underneath becoming elevated. Okay, now the Pradhana Karma, next slide. Now we are giving some incision, already predetermined areas we are giving the incision, okay, up to the blood releasing from that area properly. Okay, and afterwards again we are little bit okay, and afterwards we are keeping this horn again over that area, and we are giving the pressure over that suction pump, and that time we have to check. Usually from 0 to we that time we have performed up to the 15 degree. Up to that we have given the pressure, and automatic blood started to oozing out from that area. Okay. Okay, so this is the time to removing out the blood which already oozing out from that place. And yes, and afterwards we just cleaned or we just drained out all the stagnated blood. In case of the Bioprokapa, we have seen it, the color sometimes becoming very blackish. Okay, so this is very common feature. That time also we had seen it, and afterwards, after cleaning this area, then as the Pashat Karma, next slide. Yes. After the cleaning that entire area, then we sometimes apply, if the person is telling the yes, I am having little bit burning sensation or any pain like that, that time we are applying the madhu and ghrita, because we are knowing that madhu is having very good shodhan and ropan property, so it is actually healing those areas. So any blister formation, there is no chance of the blister, but still there would be some little bit some mark. Okay, and that also will be then and there removing within 10 days. Usually it is becoming disappear within 10 days. Okay. Now the research reports also we are getting that in Iran, one university is there, that is the Shahid University. They have shown the, remarkable result over the biochemical, hematological, animalological factors which became changed, and they also done this entire thesis work over 150 or more than patients, and it has been seen yet there also p-value became also the statistical result also showing very good after doing this cupping therapy and all. Now the latest modifications of the cupping therapy, that is the laser cupping. This is nowadays also becoming very much popular, because it has been seen here that there is having very less of blood invasion. So it is very minimally invasive procedures or non-invasive. Not only that, there is having very less chance of scar formations, and if it is forming also, still it is disappearing very fast, rather faster than the previous procedures. Okay. And now the contraindications. Yes, they are also having some contraindications. Slide. Usually it has been seen it that that time also have told it that in case of the anemic patient, sometimes we are not recommending. The person who is having the low blood pressure, that's also we are avoiding. The elder person and the children, okay, for them also we are usually avoiding, especially the children who is actually the under 3 years, we are not practicing. Okay. In case of the weak patients also, and the person already who is already afraid, for them also we are not doing, because most of the cases it has been seen it, they are also becoming afraid. Due to the afraid, they are also getting some shock. So just avoiding this kind of complications, we are not at all performing for them. For post surgery also, people's total body mechanisms also become a little bit weak. So in that cases also we are not performing. Okay. As well as the persons who is a cancer patient, for them also sometimes low platelet count is there. Okay. So in that cases also we also avoiding. Okay. Okay, next slide now. Okay, another point is the HIV patient, hepatitis B also we are avoiding definitely. Okay, usually the side effect. Okay, side effect means the adverse effect. That there is having no such of the big side effect, but this picture also is showing that is the Michael Phelps. That's I think you people are knowing that is a great swimmer in America who also performed during 2016 Olympics. Then you just see once their shoulder regions, several cupping impressions are there. So this is one of the matters. Sometimes hematoma, that is also not that much, heavy or very severe type of hematoma is not occurring. Sometimes very small type of hematoma may form. Scar formation is one of the problems. Sometimes burns, it is not happening like that way. What happening whenever the any cup we are using, when we are just putting any burning lamp inside there, and that time then and then we are just place this cup over the body parts, what happened, this cup already becoming very hot. So sometimes the edges of this cup which is already hot, sometimes it making this surrounding areas of the skin burn. Okay, sometimes what happen beside that, there is the pain also may occur in the cupping side. Even the skin infections also may occur. That is also very less if the person is taking the proper post-operative measures. Usually it's not happening. That's why in modern science, whenever I'm not modern science, in China also, in Egypt also, whenever they are performing, they are using some antibacterial cream also afterwards. But being Ayurvedic doctor, we may apply our Vita Madhu. Sometimes if it is required, then Satadhutu Grita also we may apply. Okay, and beside this, headache and dizziness, okay, and tiredness also may occur, because sometimes due to the loss of blood, people may feel like that. Sometimes people also feeling nausea, vomiting, and vasovagal attack. That's already I have told you. Any kind of shock, people also may suffer. Okay, thank you all. Thank you so much.
I request Dr. Hemant sir, if P. Hemant Kumar sir is there.
Any questions?
Yes, sir.
Any questions?
sir.
Shailesh.
Good evening, sir.
Good evening,
All the
Shailesh.
participants, if you are having any questions, you can put in the chat box, or you can ask. You can ask directly also.
Firstly, I would congratulate to Dr. Priyanka madam for nice presentation. I have some queries. Not the question. First, how to identify the cupping therapy points, and how many setting of cupping therapy should be followed? Means in one single setting, the disease will be cured, or we should go for another 2-3 settings. And indication of dry and wet cupping, and how much duration we should do the cupping.
Yes. Usually the points, how we have to select. Actually in China, they are actually using those points. They have 365 points they have already mentioned, where usually the acupuncture therapy they are going to start. I mean, they already started it. So what happened, this acupuncture, what happened, first they are putting this needle over that area. This is actually the nerve ending points. This nerve ending point, it is actually improving the usually the nerve stimulations. Along with that, the others, all hormones and others glands also becoming energized. So based on that, those points they have mentioned, and after putting these needles, afterwards this cupping or cupping set they are putting over that area. It was the actual method. Okay, afterwards happened, it was improved. Okay, it was improved by other countries like Middle East and all, even in India also. What happened in case of India, they are having no such of the points has been mentioned yet. Okay, but it has been told is some marma points, that is the vital points. We should avoid those points, because definitely we are knowing there is a chances of any kind of hurt. Then any Rujakara marma is there, then that is a problem for even Kalantar Pranahara marma. So those points we should avoid. And and based on the other points which already explained by this 365 points in Chinese medicine, so those points that along with the Ashi points according to the Chinese medicine, that is the local painful points. Okay, those points we have to first select, and based on that we have to choose the or we have to select the points. First one. Second, your question was that in which cases we have to go for wet therapy and which one for going for the dry cupping. Usually it can be seen it if any kind of muscular pain is there. Okay, they are usually this is most of the cases it is not that much chronic. Sometimes acute pain is there. In that cases we are going for the dry cupping. Okay, because dry cupping means usually the skin layers will be little bit raised up and only blood circulation will be increased, along with the lymphatic channels also will be stimulated. Okay, so in case of the acute cases we are performing dry therapy. But when we are seeing the person's already having some chronicity, okay, so already not only that, even some persons having some vein or artery related involvement. Very good example is our varicosity or varicose vein. If any kind of arterial clogs, Raynaud's disorders, okay, Bardet disorders, okay, or tie, okay, all those cases usually we are recommending for wet therapy. Their only blood circulation increasing will not help, along with if we are performing like that. Not only that, even in case of the high blood pressure patients, there's also record of little bit let out the blood. Okay, in that cases also only blood circulation will not help. So that's why we are not going for only dry cupping. That time we are recommending for the wet cupping therapy. So it's depend upon the chronicity first of all, and second one depend upon the disease their nature, based on which it is involvement of any artery, veins, or related any cardiac problems related or any other system. Based on that we have to decide should we go for the dry therapy or should we go for the wet therapy.
Okay, madam, I have a question.
Hello, doctor. Can you hear me?
Yes, sir.
Yeah. You showed a video of you doing cupping
Yes.
with a pressure monitoring gauge in it. You know, can you identify how much pressure we can use, and if there is any standardization of the amount of pressure which can be used cupping? You mentioned something like 15, 10, something like that. But is there any standardization? And the second question is, what is that device which is fitted with the meter? What is that device actually? Can you explain that? Yeah.
Yes, sir. Actually, sir, it was the thesis presentation. I mean, that time the thesis work was doing on. So what happened, the actual, what would be the pressure and how much time it should be kept along with this device and all, that is not standardized. Till now, it's not standardized, because based on that, the proper research work is still under process. It is not standardized still even. So that's why what happened, I can't say you exactly the up to the 15 lbs we have to keep this pressure and all. It can't be say that time we have performed. Might be it will be less than that, might be would be more than that. But what happened while we were performing this process, that time we continuously asking the patient, do you feel any problem, you are feeling any uncomfortable or any uneasiness like that, or you are feeling any pain over that area like that. So based on that, because there is having the standardization, that's why we just continuously asking the patient, and based on that we just did it. So that's why afterwards also it's my request also that might be in future also we are going for any other studies or any other research work. So might be we may make it some standard. Okay, based on that we may follow in future also. And these machines also, that's also we have purchased from Karnataka only. Another surgeon was there, and he also he himself was invented this kind of pumping machine. Usually it is just going to attach with the sringa or this horn, and yes, and afterwards usually we just giving this pump to make it this vacuum portions, and just by the help of the mechanisms of suction we just made it.
Another question is there is a practice like you while doing the wet cupping you apply the pressure and again you remove the blade and again the same spot you will apply this cup till the serum the serum started flowing in.
Yes.
Is that till until all the blood come out, then the serum the plain liquid serum started oozing out. Till then you do the cupping. Do you have any idea? Can you explain that kind of? Is it advisable or that is the way how it is? And do you have any kind of explanation for that?
Sir, just repeat the question again, please.
You during the wet cupping, you put the cup and the blood is the prachanam or the blood is oozing out. You remove the blood and again the same spot you put the cup and remove the blood.
No, sir.
Till there is a practice till the serum of the blood. The blood cells are not coming, only the liquid serum. Serum is coming out and then you stop. There is a practice I see and observe. Till that point, you keep sucking from a point till the serum started coming out.
Okay, actually, sir, we have done this Singava Charana for one time over the one place only, because that video also I have showed it.
That is right. I saw that, but there is a practice. Like they keep on sucking the blood till the serum started flowing out. Till the plain liquid, the serum of. So I saw that practice. So I'm just cross-checking with your experience on this.
Yes. Only one time we are doing one place only, and afterwards, another we are changing the place. Another place also we are doing, but not on the same place we are doing. Because sometimes there is the chances of inflammations or much more pain and all.
Yeah. Okay. Yes. Thank you.
Okay, madam. I can add two more additions about that question. Usually, I am doing cupping procedure with suction apparatus. So, in the suction apparatus, I am usually applying the needle and applying the pressure up to 700. That what are the readings in the suction apparatus is up to 780 will be there. So I am usually applying the up to 700 up to the suction pressure. So what I have observed is the blood flowing from the region where the cupping is applied is we are getting very good flow. And the doubt about the serum oozing, it will not be there. The complete blood in that superficial area will be drained out by applying the maximum suction pressure. So usually I am doing in that procedure, and the result will be very, very promising. And one more adding is that you showed the laser cupping. So my 100% to explain it. And also I have one more suggestion upon you, that when you are making an incision with the blade, instead of much, you can use that blade number 11.
Yes, sir. Sure. That's also, it was not that available, so it was our fault that we have not kept ready. So I also saw that one was the biggest problem for us. Definitely we have to keep some surgical blade number 11. Yeah. Next time we will be careful about it.
You showed the laser cupping. Will you please explain?
Yes.
Regarding laser cupping.
Yes, sir. So laser cupping now it is becoming nowadays. Gradually it is becoming familiar with others, and actually laser is also having the penetration power. It is also penetrating the skin up to, I mean, more than 4 mm. So that's why it is also giving some blood circulation. It is also becoming increased. So that's why not only in case of any skin disease and all, it has been seen here the laser therapy also, this laser cupping also helping for the varicosity also. In case of the varicose vein also, it's working very nicely. Okay, so like that. But still this laser cupping therapy, this research work still going on, and hopefully within some years it will be available in India also.
Okay, what will happen when you applying the cupping over the varicose vein? Is it will be bleeding will be heavy?
Bleeding will be less. It has been told yet, I mean, sorry, bleeding or not would be less. I mean, it has been seen yet any kind of complications, like sometimes what happen in case for us, whenever we are doing any Shira Veda and all, so sometimes patients, this 250 ml and more than that, the bleeding is continuously oozing out. It's not becoming, I mean, stopped yet, but it has been seen yet, and still now the research work is going on. It is not proved yet, but it has been told up to that it is also controlling the bleeding also. Sometimes whenever we are removing, there is a chances of the clotting and all, but still now it is contradictory because the proofness is not there. So we are thinking might be within 1 year the entire report will be coming. Based on that only we will purchase the apparatus. Now it's not possible, but it has been told yet that it will be the non-invasive or minimally invasive procedures in future.
Okay, where will you get that that laser cupping?
Sir, still now research work is going on. So that's why we were waiting. We are also having no laser therapy still now. So we are waiting. Whenever it will be, sanctioned by government or by some research laboratory and all, afterwards might be it will be available, and that time we also will purchase. And then over that we will go for any research, further research or and all.
Next question from Brijendra Godra. Brijendra Godra.
हेलो, गुड इवनिंग मैम. सर मैम मेरा क्वेश्चन है कि क्या कैल्सिफाइड यूट्राइन फाइब्रोइड में कपिंग थेरेपी यूजफुल है?
देखिए, बात है कि जो आपको जो ये है कपिंग थेरेपी से बोलते हैं कि जो ब्लड सर्कुलेशन ऑब्स्ट्रक्टेड हो गया है उसको ब्लड सर्कुलेशन को अच्छे से होता है. ओके, फर्स्ट ऑफ ऑल. सेकेंड ऑफ ऑल, इट्स ऑल्सो हेल्पिंग टू स्टिमुलेट all the organs. I mean, that would be stomach, that would be intestine, that would be kidney, urinary bladders and everything. Okay, so whatever that, even it has been told here that in case of the menstrual bleeding and all, that also be controlled by this cupping therapy if the person is taking in by some periods and all. Okay, so what happened, ये जो कैल्सिफाइड आपने जो बोल रहा है, इसके ऊपर अभी तक रिसर्च, जब तक ये रिसर्च कंप्लीट नहीं होता है हम लोग बोल नहीं सकते हैं. पर क्या होता है कि बोला गया कि कोई भी जो हम लोग का जो ऑर्गन्स है उसको स्टिमुलेट करते हैं. तो ऐसे भी एक बात है जो मैंने यहाँ पर नहीं बोले थे, जैसे किडनी स्टोन और जो बोलता है कि रेनल स्टोन, तो रेनल स्टोन भी बोलते हैं कि कपिंग थेरेपी से निकलता है, पर आज तक इसका कोई प्रूफ नहीं है. तो इसलिए ये जो होता है ना कि हाँ इसमें ये भी हो सकता है, हार्निया भी ऑपरेशन हो सकता है, इसमें बहुत सारे लोग बहुत कुछ बोलते हैं. जितने दिन तक एकदम प्रॉपर रिपोर्ट्स हम लोग के हाथ में नहीं आते हैं, प्रॉपर रिसर्च वर्क, हम लोग बोल नहीं सकते. पर दैट्स ट्रू दैट इट्स ऑल्सो स्टिमुलेटिंग ऑल द ऑर्गन्स. सो हो सकता है कि इन फ्यूचर कोई रिसर्च में ये प्रूफ भी हो सकता है कि हाँ भाई ये जो कैल्सिफाइड स्टोन है वो भी निकल सकते हैं, या फाइब्रॉइड्स व्हाटएवर हो सकते हैं. पर अभी तक हम लोग के हाथ में कोई रिसर्च पेपर है नहीं. दैट्स अ मैटर.
ओके, थैंक यू. थैंक यू.
Madam, there is one more question, doctor. Is this procedure is useful for PCOD?
Same like PCOD, same like the answer is there. That is, it's also stimulating all organs. But still now the reports we are not. That's why I have not mentioned when I was telling what is the benefits. Just I researched and more researched, and whatever the contradictory portions that in case of the anemia also I have mentioned it. So same like PCOD also we have not got any reports like that. Whenever we will be getting, definitely we will go for that. Okay. But we may go for the research work. Okay, no problem.
Okay, hemiplegia में होता है क्या ऐसा पूछ रहे?
Hemiplegia we may use because in case of usually any kind of arthritic problem, any muscular problem, any degenerative problem, it's usually what happens. Usually blood circulation increasing, then and that the cells, those are also, they are also becoming proliferated. So whenever any kind of degenerative conditions can be treated by this kind of cupping therapy, then we may apply any kind of hemiplegic conditions also, because muscular regions whenever it is involved there along with any nervous system also, because I have told it the points has been chosen based on the nerve ending points. So whenever we are giving any cupping therapy, we are choosing those kind of nerve ending points. So usually it has been seen at any kinds of hemiplegia, paraplegia like that, there's also it's giving good result. Okay.
Thank you very much, Dr. Priyanka Ganguly madam, for your all your answers. I request P. Hemant Kumar sir to give the expert opinion on today's lecture, sir.
First of all, I congratulate Dr. Priyanka. A very nice presentation and with authentic proofs, and the way of presentation was very nice. And she answered almost all the questions asked by the various practitioners and teachers. And first of all, keep in mind, see, cupping therapy is not a it is only the treating all the diseases. It is wrong, and every therapy has some limitations are there, and we can't. We can treat varicosity, we can treat fibroid, we can treat kidney stones. It is wrong actually. Why? Because here the main importance, what the basic of Rakta Mokshana, we can see that either varicosity or any other disorders, it relieves the present condition. We can't remove everything. For example, varicosity. At least we can reduce the progression of the varicosity and reduce the pain, cramps, and skin lesions, especially what complications of the varicose veins. I think under my guidance, one student conducted the first thesis in India, Srungavacharana in 2010. We conducted a study on Srungavacharana in varicose veins, and we conducted Doppler study before and after therapy of Srungavacharana as a classical Srungavacharana according to Susruta, and modified Srungavacharana like that. But in that condition, we have seen that some the main the varicosity veins, the main importance is incompetence of the perforators. That is the incompetence of the perforators that can is relieved the obstruction and increase the blood flow, and to avoid the further progression and further complications like dermatitis, blackish discoloration, we can avoid in that conditions. Same thing, cupping therapy is also same thing. We can reduce some of the conditions. We can't eradicate and all the diseases. Okay, and especially we are seeing this treatment, especially for some psychological disorders, so headache, migraine, and neurological conditions, musculoskeletal disorders. There is a wonderful relief. We have seen that, and definitely this type of therapy also one of the great contribution of our science. And once again, I congratulate Dr. Priyanka for the nice presentation, and thank you. Thank you for all participants regularly attending our National Susita Association program. Thank you.
Thank you, P. Hemant Kumar sir, for your expert opinion on the end of the session. I thank once again Priyanka Ganguly madam, and I thank all the participants who joined us. We are once again going to present the same lecture series with different topic with a different speaker next Friday, same time, 7 to 8. Please join us. Good night, everyone.
Thank you so much, madam. Thank you, everybody. Good night.